We will now look at the growth and development of the toddler. And so you'll want to look at your PowerPoint beginning with the toddler section. When we look at just the appearance of the toddler, very specifically we see that they're sway-backed, which is normal, or pot-bellied. Their legs are very short, and so they look out of proportion to, say, the preschooler or school-age child. The toddlers, because they're learning autonomy, begin to assert themselves within the environment. So we often see them exhibiting temper tantrums, and that's something the parents often present as a question of concern. Because of some of these changes that are driven by the growth and development of this age group, they are sometimes labeled the terrible twos because of the difficulty in their adjustment to what is acceptable socially, and then when they're trying to exert themselves. Another big issue for the toddler period is that of toilet training. And there again, we think or should address the issue our principle of readiness. When is a child ready to be toilet trained? When do they physiologically have the ability to hold and let go of that sphincter? And when do they have the attention span to devote to the process of, a stool evacuation or having a bowel movement? They are learning to say no, and they realize they get a response from adults and others when they say no, so it becomes a pretty much of a reinforcement to them to say no at times, and even when they feel like the answer is yes. They are very egocentric, meaning that they can't appreciate the views or values or positions or how someone else feels in a situation. They can only be concerned about themselves. So it's very difficult, almost impossible for a toddler to share. They're only thinking about themselves in a situation. When we look at their growth, we note that it is a plateau period, meaning that their growth period slows, and then associated with that, their eating decreases. When they have been very much active in that eating process and now they just suddenly stop, then parents often are asking, the healthcare provider, what's wrong? Is he eating enough? And it is sometimes referred to as a normal type of anorexia that we see in that age group, that it's not pathological at all at that point, and they've gotten their motor ability under control, and so they want to be on the go, and they want to be moving and doing, and they don't often want to be socializing or sitting at the table with others. That's not of interest to them. When we look at some of the milestones of growth and development that you can follow also in your textbook, that toddler period beginning from 1 to 2 years of age and up to 3, their gain is about an 8 ounce or more per month. So see, it is a slow period. They grow 9 to 12 centimeters during that entire year of that yearling period, that 1 to 2 year period. When we include assessments, we should note that their anterior fontanelle should close around 18 months. It may have just a partial opening up to this 2-year period, but the general ballpark number, the average that we consider, is 18 months. The fine motor ability, by the end of that second year, we look at how they can maneuver objects. So they should be able to stack a tower of 4 blocks. They should be able to scribble without being coaxed to do so. They just immediately do that. They make marks or scribbling motions on a paper that they have the hand coordination to do that. They can undress themselves, and they can throw a ball. When we look at gross motor, they should now have been walking since at least 15 months of age, so now they may be doing some running. They show a growing ability to walk and to even walk with ease, without any stumbling or falling. It's a pretty easy maneuver for them. They should be able to walk up and down stairs at a few months after learning to walk. So if they've learned to walk around 15 months, about 18 months or so, they should be going up and down stairs. They really enjoy in this age group when they've got this motor ability to utilize and to play with push-pull toys. And you'll often see test questions that ask you to consider what would be a toy or play activity that would foster the development or a developmental task. So for this age group, then, a push-pull toy would be something that they would enjoy doing, like the little popcorn poppers or the little mowing machines or even the little small grocery carts. So all of those would be of interest to them. Their visual acuity is about 20/50 at this stage. Then when we move forward to the 2- and 3-year-old, their gain is only a 3 to 5 pound gain in a year. And so their height will increase 2 to 2.5 inches during that age period too. This older child, the 2 to 3-year-old, should draw a circle, and it will be a rudimentary type of circle, but it's 2 lines are adjoining and make some type of a round closure. They learn to pour from a pitcher or a container, and they are learning to dress themselves even more completely. They can jump, they can kick a ball, and they throw a ball overhanded. So these are things that you would assess for to see if they had accomplished or they had the ability to perform, both in their fine motor and gross motor abilities. This slide just shows you again some more examples of this age group or that toddlerhood where they're learning to put on loose type of clothing as they're walking up and down stairs, that they're able to do that with holding on, of course, and then you see a young child playing with a push-pull toy. The psychosocial development during toddler period, we look at them refining some of those fine motor skills, and we look at their ability to communicate increasing. They certainly have a large increase in their vocabulary during this period of time, and it may be difficult for them to put their words together as fastly as they would like to, so we might see some beginning stuttering occurring or inability to pronounce certain letters, T's and S's and R's, for example. But as a rule, we don't refer them to speech pathology or therapy until they're started school. And if they're still doing that, most kids will grow out of that. So we give them that time frame to grow. They like to play in situations that are set up like a kitchen or a grocery store, or the use of a telephone and talking. They like the maneuvering of a tricycle or a big wheel, and they like playing in mediums such as sand or water. So these are things that you could consider when you are providing instructions for parents about what type of play activities would assist them in their growth and development. Biological development, the weight gain, of course, slows. They may have a 4-pound weight over that year. Birth weight typically quadruples by 2.5, but that's based on the normal newborn weight, so around a 7-pound newborn weight. So it's just small little steps of increments when you plot them on a growth chart and compare to what their development is. Their hearing, smell, taste, and touch, all of those senses are increasing as their environmental exposure increases to different foods and smells. So encouraging them to expand that environment and to smell certain things and give names to them, of course, is developmentally, appropriate to do. When we think of growth and development, we also have to consider physiologically the maturation of their systems, or how is their body internally growing. Physiologically, at this age period, or the end of toddlerhood, most of their organs are functioning at a pretty stable amount of functioning. They still will have upper respiratory infections as being a common illness, accompanied with otitis media, and then that repeated upper respiratory infection ultimately compromising the lymphatic tissues of the tonsils, and decisions made whether having a tonsillectomy then is considered. During this period of time, again, the parents are addressing voluntary control elimination or toilet training, and it's not really till sphincter control physiologically is there to about 18 to 24 months. So attempting to do that before that age sometimes is not hitting that readiness for the child, but rather the readiness for the parent in that situation. We want to promote the optimal growth and development, so the parents need to be aware of what's normal and what's associated with that terrible twos, and how they can handle temper tantrums, how they can maintain safety for the toddler. And so remember, that age group is 12 to 36 months, or up to the 3-year-old. They've got those motor skills and fine motor, gross motor, so safety in the home is a big concern. They like to explore, and they're starting to climb, and they're into things. So re-emphasizing teaching regarding safety is very important with parents of children within this age group. Remember, they're in autonomy versus shame and doubt as we look at the psychological development. When you would have to perform certain procedures with a toddler, how we would communicate to them is pretty much different from other age groups. The procedure can be perceived very frightening. They have fear of the unknown. And so to communicate with them effectively, to provide a traumatic care, so that you are, what we're saying is that you minimize the trauma. So that is referred to as atraumatic care, atraumatic being one word. So we don't want to tell them about something too far in advance. They don't have an understanding of time, that concept. We want to use a very simple terminology, and we want to just explain one thing at a time. We tell them what their parent can do to help them, what they can do to make it go faster or quicker, so that they feel some control over that. Always to allow them to cry, and it's okay to cry. We would not want to verbalize in any way that that is a negative thing for them to cry. The procedure or the event, the issue, may be very frightening to them. So knowing that that might be a behavior that's exhibited, we need to be accepting of. If at all possible, you would want to perform a procedure in a treatment room rather than in the toddler's bed. So starting an IV, for example, it would be better to do that in a treatment room and deal with that procedure so that their bed becomes a safe place, that bad things don't happen there. When we're doing a procedure with the toddler, remember safety is very important. So how we minimize their movement, how we control their environment becomes part of our nursing function. They may feel a Band-Aid is very magical to them. It can reassure them. It helps them to identify that opening, things won't come out of it. So that can be utilized to help them feel better about an event, such as a blood drawing procedure or an injection. We would like for them to have a reward. Food should not be the reward, but rather a sticker, an activity, a colored square they can place on, a monthly calendar. And praise, find something that you can praise the toddler about with his cooperation, so that, again, we're not lacing this procedure with negative connotations for him. And then, of course, we need to provide comfort and consoling, and allow the parent to be a part of that as well. So something that might soothe them might be to, do you want to listen to this song? I know it's your favorite song. So something that they would like and appreciate would be good. So their locomotion is improved between these ages of 2 and 3, and fine motor development also improves. Their manual dexterity, throwing a ball at 18 months, having a neat pincer grasp at 12 months, where they have that very neat, clean thumb and finger opposition at picking up something, and that they've mastered that. That's what we mean by it being neat or clean in that particular fine motor skill. The autonomy versus shame and doubt, negativism, rituals are very important. And we need to know what rituals are done in association to bedtime or medication administration. What can that child expect? And we should try to mimic or provide those same types of rituals and time frames as they used at home. When we think of cognitive development, they still are very concrete, and that they don't have the understanding of concepts or cause and reaction. They may know that something causes something to happen, but they don't completely understand the relationships. They may begin to learn groups or categories. That, apples and oranges are fruit, for example. They'd like to mirror the things that they see occurring by the adults in their household. So the domestic mimicry is very common. Playing house, going to work, dusting, washing dishes, etc. So those are things that they can do that help them even try on the roles of others in society and familiarizes them with extending their environment and people in their environment. The preschool period, the ages 3 to 5 years, are very imaginative years. Very much heightened creativity, heightened interest in outings and museums and libraries and different field types of trips to a park, for example. They can attend to and deal with separation better. Of course, that can be altered by, what their experiences have been. If they've never been separated from their parent for any length of time, initiating that in, a hospitalization would be very difficult. They have a little bit increase in attention span, and a rule of thumb is about 1 minute per year of age. So a 3-year-old about a 3-minute attention span, a 5-year-old about 5-minute attention span. The preschooler, very imaginative, can't separate fact from fiction. Gross motor, they're walking, running, climbing. They've got all those motor skills. So again, laced with that are going to be concerns for safety. They may be able to climb a tree, but they don't understand, how am I going to get down from that tree? And if I jump, what negative impact that could have. So they can't walk through those possibilities with their cognitive abilities. They're starting to draw more, a stick figure, skillful manipulation, using scissors and using different art mediums become, of great interest to them. Again, here's that word readiness. So we're talking about cognitive readiness here, but also physical. Does this preschooler have the attention span, or can they sit in a seat for 3 to 5 minutes? Do they have the ability to concentrate for that length of time to do something within a learning environment? And then that word readiness can be used throughout growth and development. Your readiness to enter a nursing program, what all had to come into an alignment for you for that to be the optimal time for you to pursue, your career. So, remember that word readiness. The psychosocial development, Erickson says they're developing a sense of initiative. If their developmental task is to initiate something, they may still feel pulled back by, I really can't do that, or I don't know if I can do that, or what will happen if I do that. So feelings of guilt and anxiety and fear can occur when they're doing or attempting to do new behaviors. There is a beginning development of their superego or consciousness. So we want to begin introducing right and wrong to them and sharing and caring, but it's at the beginning point, that preschooler is still not ready totally to understand the viewpoint of someone else, or how they might feel, or how that might hurt them. But they are at the beginning of learning right from wrong, and so that should be included in their parental teaching and of examples. During the preschool period, their physical growth slows, but it's stable. It's a pretty stable time period, or should be, when you compare them to their past growth, which was a plateau. It's about 5 pounds per year and about 2.5 to 3 inches per year during this preschool period. Their body systems continue to mature, and their vital signs are approaching more of what we see adult ranges. We see them having those rates decrease from that infancy period, and we would expect that. Piaget includes this preschooler in what he referred to as pre-operational phase, which really covers more than the preschool period. It goes up to 7 years, so you have to keep that in mind. He subdivides the area into preconceptual phase, which is ages 2 to 4, which is really more of the preschooler, as we've identified it by, particular age. As they approach the school age period, and you have to remember, by his categorizing, this is up to 7 years. At that point, they should be able to be considering the viewpoints of others and concern about them. Their language continues to develop and beginning to understand when things are bigger or smaller. However, they can't determine if the same matter, even though, say, a ball of clay is rolled out real thin, or if it's made into a ball, that it's the same amount of clay. They're still not able to do that at that point in time. And the concept of time is still not understood. And of course, as you've heard in class and discussion, we talked about that magical thinking that they have. And it's important to remember when they're being hospitalized or a procedure's being done outpatient, that magical thinking. And, you know, we need to know what they're thinking, what's going on, what's their perception. Moral development, there needs to be that consistency with what is right and wrong to begin that foundation of obedience. And then, of course, the big question then arises about what type of punishments are considered appropriate, and that often becomes a family belief and value. But still very concrete in regards to, you know, concepts such as justice and fairness. Their spiritual development, depending on their association with their family and what they're experiencing because of their family's practices, will depend on what their level or knowledge of faith and religion is. So they're going to pretty much mimic and practice what they see in their environment. They're not going to understand, you know, the elements of the Lord's Supper, for example. They're going to still consider when they hear that the body is the body, and so they're going to think very concretely about that. They're not really understanding what salvation means, for example. Their body image, they, in this preschool period, something that's very important to understand is that they have poorly defined body boundaries. So again, this is why they may want that Band-Aid to cover that opening where the injection was given. So that's an example of poorly defined body boundaries for the preschooler. So their heightened awareness of events and how their environment's changing, say if they're in a hospital, what impact that has on them, we need to remember. They may have a strong attachment to the opposite sex parent when while identifying with the same sex parent, and that's more from the Freudian beliefs. Modesty can become a concern, and initiation of dressing up like mommy or dressing up like daddy and doing that role play becomes a situation that we see often with the preschooler. A sexual exploration, you know, finding out what their body parts are and feeling a good sense of excitement or arousal to some extent. And then questions about, you know, the mother is pregnant now, well, what is that and where do babies come from? So answering those questions with very brief, very, short type of answers, not the whole plan of reproduction, is what needs to be shared with them. When we look at the preschool years, some milestones, that means, you know, like a developmental task, something they can do or accomplish. And you need to understand what that word is, milestones and developmental tasks. You can see here the preschooler is utilizing a safe type of scissor, drawing circle squares or a cross, being able to tie their shoe, and it may not be tied perfectly. Button clothes, if, you know, those buttons are in the front of the garment, and brushing their teeth. So these are all skills that they should be able to do and accomplish during this preschool period. They should be able to throw a ball overhanded. They should climb well and ride a bicycle. And again, some of that depends on what they've had opportunity to do. If they've never had a bicycle, then they've not had that opportunity to cultivate that skill. They may still be using, a training wheel type of device or a Hot Wheels type of riding tool. Fine motor ability, we should see that they're eating and feeding themselves. They use the spoon, fork, and knife, and they know how to do that. They, during this period, should learn their letters and their numbers, but it's very difficult for them to understand 3 is more than a 1, and this was discussed with pain assessment and pain scales earlier. So again, just to emphasize that. Some examples of pre-operational thought. We've mentioned what egocentrism is, and transductive reasoning is connecting 2 events or understanding a cause and effect relationship. Centration is focusing on only one thing in a situation, and animism is giving lifelike qualities to non-living things. So, thinking that the drapes that are moving is really some type of animal or a ghost, that would be an example of that. The psychosocial development and toys and communication, the 3 to 6-year-old can engage in what we refer to as associative play. That is a very simple game that has very simple rules, and they may only be able to follow those rules for, like 3 to 4, 5 minutes or so. Then the game just kind of morphs into something totally different. They may engage in what's called dramatic play, in which they act out a situation by the use of a doll, and often we use that when there's been an abuse in the child's life, and we'll use a doll for them to explain to us what had happened. They can relieve stress through play activities, pounding boards, splashing water. So it is a therapeutic type of intervention. Play can be used to help your child learn about a procedure. Play can be used to understand better what level of knowledge the child has, or it can be used again to be a stress reliever. So play is always a very good intervention that you could utilize with pediatric patients. Some of the parent concerns during this preschool period, the new fears that emerged that hadn't been there before, and remember that's linked to their heightened imagination, the stuttering, that they have the vocabulary, that they can't actually form those words as quick as they're thinking those words. And we usually tell the parents, well, let's just try, giving some extra time. Don't focus on it. Don't draw a lot of attention to it, and see if there's any change. Aggression, particularly if they're in a preschool setting, we often see a child now starting to bite or kick or do some type of aggressive behavior. They may have what we refer to as out of bounds gross motor behavior. When I mentioned they might have the phrase attached to them as the terrible twos, then often when everything kind of calms down, we'll see they're referred to as the angelic threes. But then the 4-year-old is often viewed as the out-of-bounds 4-year-old. And how that gets that particular title is because of their motor skills and their ability to do a lot of motor things. They're always wanting to jump or climb or roll or run, and it may not be appropriate in every situation. So if you're visiting somebody, for example. Then daycare issues. How do I know the daycare is safe? It's a good environment. Cost. What are the parameters of activities that are provided through the daycare? The fantasy versus fiction. You know, they said this happened, and you're going, I don't think that really could have happened, but it's their imagination, perhaps, and their tall tales that they're expressing. The preschooler, we see more pronounced that they have food dislikes, to the extent that they're very suspicious of casseroles, for example. They may not want food touching another food, or they won't eat something that's been mixed together or it's touched by another food. And some adults still have that same food dislike in manners and behaviors about eating. Again, they'll have decreased eating, and so the parent usually is asking, well, what's enough? You know, how do I know he's getting enough of the nutrients that he needs? There may have come on board now the other siblings, so, you know, they're having to share some of that attention, and so sibling rivalry may be a parent concern that's asked about. The non-sharing child, we talked about that. Why they would have injuries because of being that out-of-bounds 4-year-old, for example. Then if we're looking at preschool settings, what is the school readiness for the child? Is he able to do that? Then another issue that's often asked of caregivers is how long should he sleep and where should he sleep? And now he's having night terrors. And what is that, and what do I do about it? So those may be questions that you'll even see when you go to the clinic. You'll see parents asking about particular behaviors and if there's something that should be done or what's right or what's wrong. Safety, the major cause of death in the infant, toddler, preschooler, all the way through adolescence are accidents. So I would like for you in your group at some point, or within, you know, you as you're listening to this, think about some safety tips that you would provide for a family of a preschooler. And this also could be what you might want to develop at the Hispanic Health Fair, and then at the showcase, you might want to present how parents reacted to your presentation. So those are things that you might want to consider. You won't be doing the preparation notebook, so just disregard that at this time. So promoting health, we also look at nutrition. The calorie requirements for the preschooler is about 90 kilocalories per kilogram, and their fluid requirement is 100 milliliters per kilogram. So you can see now how important that weight is and how we look at that from your standpoint of determining a safe dosage of the medication, and now here to, you know, calorie and fluid requirements. Again, they may develop some food fads where they'll go for a whole week and they just want to eat, you know, carrots every day. And then the next week they don't want any carrots. They want something else. So, you know, you just kind of look at the overall picture and see is it being balanced, you know, out over several days. Now, the school-age child is generally defined as the 6 to 12-year-old. Physiologically, they begin shedding their first deciduous teeth around 6 years of age. And remember, they obtain their first deciduous tooth around 6 months. So if you can remember that 6, you know, that will help you in looking at those boundaries. Their growth and development is gradual. It should be gradually increasing over that period of time, the 6 to 12-year-old period. Their height should increase about 2 inches a year, their weight 2 to 3 kilograms, and it'll be a little bit different for males and females. Females generally have a greater growth spurt than males do until we hit that adolescent spot. Their bladder capacity increases during the school period, so it's more approaching the mature adult capacity. Their heart becomes smaller in relation to the rest of their body, and their immune system increasingly becomes more effective. However, they're at greater risk because of being in an environment with multiple children of being exposed to more bacteria and viruses. So sometimes their growth doesn't match up to how mature they act as well. So if you have a school-age child who's kind of lanky and tall and, you know, they may not have the maturity level that you might be associating with the size of that child, so you have to carefully assess the two. Now, at the end of this school-age period, we can see a stage called prepubescence, which is 2 years preceding puberty. So again, just another term that you might see, and that age is a little bit earlier for girls than for boys. But when we think about their relationships during the school age period, it's usually with the same sex. So they just, if it's a young boy, he has, you know, friends that are boys more so than girls. And again, that'll depend on what his environment is and how much association he has to the opposite sex. So those are some things just to remember. And the school-age child is in industry, and they like to complete things, they like to collect, and they can categorize objects. So these skills that are mentioned by Erickson is very much a motivator for them, as well as their peer approval becoming more so of interest to them than their family as they grow through that school-age period. Inferiority can emerge as a negative outcome during this period if they're made to feel that their choices are not correct, or that their self-esteem is lowered, or their physical abilities and appearances are different than others around them. Piaget says that the concrete operations or thought processes are what occur during the school-age period. They can now go from categorizing, like the preschool did, to understanding relationships between things and ideas. And they're able to make judgments and reasoning based on that. So that's called conceptual thinking. The physical growth during that school year, 3 to 5 pounds a year, you can see that. They enjoy a lot of associated organizations, you know, Cub Scouts, groups at church, their soccer group. So, you know, that becomes of interest to them. They also enjoy what we call board games. And typically on NCLEX, when that is mentioned, they can't say a game like Monopoly. It would just be referencing that category of game as a board game. They can begin to ride, you know, a two-wheeled bicycle during this early school age period. They can read. They're able to concentrate for longer periods of time, and we can see that they, you know, are more involved in those other activities. Their gross motor development is just, it's there. They're just maturing it, and they're refining it, and the accuracy of, you know, hitting a ball with a bat, you know, all of those things emerge, and that sense of industry, again, to their cognitive growth and their ability to accomplish tasks is important to them. So industry versus inferiority, in that school age period, towards the middle and end of it, they start understanding conservation of matter, according to Piaget. In the example I gave with the preschooler, not understanding it's the same amount of clay if it was rolled out in a long snake or if it was in a round ball. So Piaget says they should have the ability to understand that during the school age period. When you're teaching a child of that age, you could use an anatomically correct diagram or picture to show them like where an incision might be or where they're going to, have an x-ray of a particular area. But you always want to assess their knowledge level first, like you did with your diversional activities. You always find out where your learner's at and determine what amount of information needs to be included in teaching. Remember, they are a collector of things. They like groups. They like to be with their same age group in projects. So, those are things that are a little bit different for them. They're able to play more cooperatively, meaning there are set rules and they'll follow the rules. But even through that beginning school age period, they want to win. So they may be very, very competitive about that, and sometimes the rules can change in the middle of that board game. Then when we move on to the adolescent, of course, they should be becoming less dependent on the parent. Their peers are more important to them than the parents in the past age groups. They need the ability to assert independence. They like that social activity of movies and dances and driving and eating out. So they're on a quest for what's the rest of my life. They're very futuristic, so that is why sometimes they take risky behaviors. It's not going to happen to me, and they're kind of driven by that internal feeling of my whole life's in front of me. I get to make choices. I'm going to drive. I'm going to go to school. I'm going to earn money. I'm going to, have a girlfriend. I'm going to get married. So nothing really bad could interfere with any of that. And so that is typically why they will take risky behaviors. That's not going to happen to me. That happened to Joey, but it's not going to happen to me. So, of course, that gives the parent, a heart attack over, knowing they're driving too fast or whatever bad judgment they might make. With the adolescent, we see that as the second growth spurt, with infancy being the first. So we want to assess its their skeletal function, their curvatures of their spine, if all of that is still appropriate for them with their physical assessment. Their skills are all well developed in their motor abilities, so it's just progressing intellectually with that and with friends and classmates. So if they're hospitalized, it's very important that we're aware of what their peer group is and have them involved in encouraging them. So with each age group, infancy had the largest amount of things that change or develop. We look at physical growth, we look at cognitive, psychosocial, their personality or their temperament, their communication skills, sexuality, spirituality and practices, activities or types of play, temperament and resilience, and good fit. How do they rebound in a situation? Are they resourceful psychologically to deal with a crisis that comes their way? And so what are the parent concerns, and what is the whole family unit? What type of family unit is it? How do they make decisions? How do they grow and function? And then what is their social health, their financial health, their physical health? What's their ability to encourage the educational development for that child? What are their resources? So for every age group, we need to be considering those too. And this is an example of an article, and your textbook also discusses resilience, and that's a little bit newer with looking at evidence-based practice, but we should assess what is the resilience of a child, meaning, what are his coping skills, how well can he handle a situation, and the parents as well. So that becomes, an added concern with our assessment of any age group. So what I would like you to do is think about how your interventions, how you might communicate with each age group. If you knew you were assigned a toddler, a preschooler, or an adolescent, what might you say first to them when you're going to your clinic experience or your school experience? Think about a question that might focus on them rather than doing this particular one with your partner. I would like for you to think about what's going to be the first thing I say when I go to that clinic experience or the school one. What can help me best understand that child in the shortest amount of time that I have available? So that concludes the growth and development lecture. When we look at psychosocial, when we look at fine motor, gross motor, and physical changes. The greatest detail of changes are in infancy, and then the magnitude of those in also our growth spurt for the adolescent. So as a nurse, you need to be equipped with the skills to make those assessments. When should they begin a skill? When are they doing it pretty consistently? When should they have mastered it, like when I referenced a neat pincer grasp? What is their readiness for any situation, whether it be toilet training, but starting school, or it to be readiness for teaching on how to give an insulin injection. So we're always looking at that and the potential for regression and for them to regress to a former age level when they are forced to deal with an illness or a complicated issue, because that's more comforting to them. So, think about what your role is as a nurse in looking and examining growth and development along with your physical assessment now. Your first quiz will be coming up, and I'll make an announcement about that in class in regards to what you need to reference and study the greatest for that first quiz. So I hope this information and explanations for growth and development that you find helpful. Be sure and look at your textbook readings and then do test questions that are provided in your HEI pediatric book on growth and development, and see how well you're progressing with that. So this particular presentation was about 15 minutes in length, so a good time to stop at this point.